What about your personal philosophy or viewpoint? Are you a rabble-rouser?
Oh, Melanie, how could you? Oh, how could you have said such a thing?
When Father Claude Dutil began his peanut butter ministry 40 years ago, the idea wasn't universally popular at first. Many businesses and individuals worried that IHS would attract more street people to their area, or that Father Claude was just encouraging freeloaders with handouts of peanut butter sandwiches. Those concerns were voiced in newspaper editorials, neighborhood board meetings, even city council meetings. But for every criticism IHS faced, there were dozens of churches, businesses, and individuals that recognized Father Claude was offering more than handouts. He was offering understanding, support, and hope to a population desperately in need. Father Claude wasn't interested in creating dependence. His goal was to assist people through their time of crisis to get back on their feet and back into a home.
Everybody who comes into our place, if we can help, if we can make it work, we'll have a game plan, where they're headed in life, and then we help them achieve their game plan.
Because of the generous outpouring of support from the community, IHS survived those difficult early years and began to thrive as a sanctuary for those needing help. And who were those people? At first, many were from the mainland, people fleeing old lives, hoping to start over in paradise, or people stranded when jobs or marriages didn't work out. Only about 26% were local. But from the beginning, Father Claude recognized he was serving an increasing number of individuals with mental illness. As the state hospitals began facing increased cuts and closures, he realized these individuals would become a growing challenge to assist. Released with nowhere to go, no means to support themselves, and too mentally ill to even know how to go through the process of applying for assistance. Father Claude understood that stabilizing these people would require clinical intervention. He formed partnerships with mental health centers to provide volunteer social workers, a nurse, a psychiatrist, and doctors. Through the first 10 years of IHS's existence, a significant shift took place in the demographic population of homeless people. With the dramatic cuts to social services and funding for construction of public housing, rising costs of living combined with low-paying jobs, and the closure of state hospitals, there were an estimated 2,500 homeless in Hawaii by 1987. 70% were local residents, and 30% of them were suffering from physical or mental illness. At that time, IHS was serving over 600 meals a day and sheltering up to 250 people a night, approximately 80 of them women and children. Father Claude understood the need to be able to adapt facilities and services to provide for the specific needs of the changing homeless population. He continued expanding partnerships with healthcare providers to increase access to essential medical care, eventually resulting in the opening of a health center within the Sumner shelter. He also advocated for a second emergency shelter to be created that could accommodate women and families with children.
After we started getting many families and also women with children, he really dreamed of having a spot where he could put the women and children separate from the men and have two places.
Then, in 1987, Father Claude was diagnosed with Parkinson's disease. And though he remained active as IHS's director after his diagnosis, he announced his retirement as director in 1990, passing leadership on to a new generation. Father Claude Dutil passed away on January 22, 1997. Since then, we have maintained Father Claude's core values of helping anyone in crisis to stabilize and receive assistance. And we've continued to recognize the changing needs of the different homeless populations we serve and strive to adapt our services to meet those needs. As Father Claude used to say, there is no such thing as a typical homeless person. He believed it was critical to tailor solutions towards individuals, and by pursuing this goal, we've become a fully integrated homeless service provider. Thousands of homeless people continue to seek shelter with IHS annually, and each year, thousands integrate back into the community. Still, there is a large population of chronically homeless in Hawaii, people with mental illnesses or serious substance abuse dependencies who remain homeless for decades. In addressing this challenge, IHS has developed new strategies to help get these individuals better access to the medical treatment they so desperately need. This is the goal of our street medicine team, and the results of this endeavor are highlighted in Prescribing Hope. Much has changed in the past 40 years, but what has not changed is IHS's unique position in our community to assist a wide array of people in crisis and provide services to help them end their homelessness. And with the generosity of churches, businesses, community groups, and individuals who tirelessly volunteer their time and resources, prepare meals, and donate goods and funds, IHS stands today as Hawaii's oldest, largest, and most comprehensive homeless service provider. All of you have helped make Father Claude's vision a reality and have changed the lives of countless thousands of people.